In order to reach the leg from the heart, blood would pass from the left ventricle through the arch of the aorta, through the thoracic aorta, then the abdominal aorta. Both of these can be called the descending aorta. And then the aorta would split into two common iliac arteries, and after the internal iliac splits, to the external iliac artery, to the femoral artery as it enters the leg. Once again, in this model, blood would pass from the left ventricle to the arch of the aorta, to the thoracic aorta, to the abdominal aorta, which would then divide into common iliac arteries. After the internal sprouts off, this would then become the external iliac artery, going into the thigh to the femoral artery. The femoral artery would dive through adductor muscles, where it goes behind the knee and becomes the popliteal artery, and in the lower leg to the tibial arteries. There are several paths back from the foot to the heart, including one traveling through the great saphenous vein. But using similar vessels, blood could travel through the tibial veins, behind the knee to the popliteal vein, which would then become the femoral vein, enter the body cavity and become the external iliac vein, then fuse with the internal to become the common iliac vein. The two common iliac veins fuse to form the inferior vena cava, which will travel to the right atrium. In this model, blood would travel through the femoral veins to enter the external iliac veins to become the common iliac veins. The common iliac veins would then fuse to form the inferior vena cava, which would then travel to the right atrium where it would enter the heart.